Well, thank you for all of your work today, and I'll be right back with some more questions, okay?
Hi Matt, come on in. I'm really glad I had the chance to observe you do that initial assessment with Mrs. Brown. I have a bit of time right now. Do you mind if I give you some feedback on how it went?
Sure, Rebecca, that would be good. Where should we begin?
Well, before I give you my thoughts, how about you tell me how you think it went?
Well, judging by what Mrs. Brown told me and what I observed, I felt that I assessed her ADLs and left side impairment fairly well. It was my first time doing a full assessment by myself, but I think I asked all the right questions and did a very thorough job.
Yeah, I noticed you took some really good notes and asked some really thorough questions, and that's important. It was also really good how you just took your time with Mrs. Brown so she would feel at ease and not too rushed. So good for you. Now, I was noticing that there was perhaps one area that you could improve on for the next time you do an initial assessment. Throughout the assessment, I noticed that Mrs. Brown was visibly upset. It can be really distressing for patients when they have a stroke, and it can be quite overwhelming. It's important that we acknowledge those feelings and address them appropriately. It also helps us to build rapport with our clients too.
Okay, well, I guess I was so focused on taking notes, I didn't observe that she was upset.
Yeah. Well, don't be too hard on yourself. Do you have any ideas of how maybe the next time you could address the more emotional and psychosocial needs of the patient?
Well, I guess next time, as well as looking at her self-care, upper extremity, all those other things I should be looking at, I should also be focusing on how she's looking, her emotional state, and if she seems at ease or if she does seem upset, making eye contact.
Those are all great ideas, and maybe just try smiling a little bit at her. You know, it can be really hard when patients have to face the fact that they may not be able to golf, ride a bike, or knit again. So it takes a little bit more effort and observation on our part to go beyond the physical and cognitive and perceptual assessments and to empathize with them. But overall, Matt, I think you did a really great job. Well done.
Thank you.